Hi, my name is Steven, and today we're going to talk about tuberculosis. Tuberculosis, or TB as it is most commonly called, is an infectious disease caused by a bacteria called mycobacterium tuberculosis. And this disease is most common in Southeast Asia as well as Sub-Saharan Africa. Tuberculosis can affect pretty much any organ in the body, but it most commonly affects the lungs. And so people most commonly go to the hospital complaining that they have been having a cough that isn't going away with the most common treatment. But sometimes they might be complaining of other things, including abdominal pain, depending on which organs have been affected in that particular person. Now, tuberculosis, technically we have had treatment for tuberculosis since the 1940s, but then the problem that we have is that treatment for TB must be taken for at least 6 months, while for most other bacterial diseases, treatment can only be taken for 7 days and the person will be cured after that. And because this treatment must be taken for at least 6 months, sometimes it is difficult for people to take their medicine and they end up stopping taking the medicine after just a few months. And sometimes, because of things like this, we have development of multi-drug resistant tuberculosis. It is therefore very important that we come up with new drugs that can be taken over a shorter period of time. Currently, the drugs that are most commonly used against tuberculosis include rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. And most of these drugs work in two main ways. Some of them interfere with the ability of the bacteria to produce proteins, while others interfere with the bacteria's cell wall. To tackle the problems that we have with tuberculosis at the moment, there are different strategies that are being followed to come up with drugs against TB. Actually, there are two main strategies that are being followed. First is coming up with drugs that will interfere with the bacteria directly, which is quite similar to what we already have in practice. But what we are now trying to do is coming up with drugs that will target different proteins that we haven't been targeting previously. And this includes proteins that are involved in the metabolism of the bacteria. And another interesting strategy of targeting the bacteria is coming up with drugs that, instead of attacking the bacteria, will target the human cell. What is important to note about tuberculosis is that this bacteria that causes tuberculosis is actually able to survive and thrive inside macrophages. And these macrophages are a type of white blood cells that are normally able to ingest and digest different bacteria, but they are usually not able to do this effectively in tuberculosis. So currently, some of the drugs that are being tested against tuberculosis are trying to improve the ability of these macrophages to take in as well as digest the bacteria so that it completely dies. And also, another important strategy of targeting tuberculosis is reducing the amount of damage that occurs to the lungs and other organs in people with tuberculosis. Another thing that is important to note is that actually in people who have tuberculosis, most of the damage that occurs to the tissues is actually not caused by the bacteria itself, but rather it is caused by the white blood cells, which are trying to kill the bacteria, but instead they actually end up doing more harm to the human's own tissues than to the bacteria. And it is therefore important that we ensure that these white blood cells do not cause a lot of harm to the human being, but that instead they cause that injury to the bacteria. And in doing this, we ensure that even after the person has been cured of the bacteria, their lungs and other tissues are still in good health. Because sometimes what happens is that after someone has taken the anti-TB drugs and the bacteria has been completely killed, you see that still during the infection, a lot of damage had happened to the lungs, and therefore that person is still going to have problems with their lungs for the rest of their lives. So in ensuring that we don't have a lot of injury occurring to the lungs, we can ensure that after curing people of TB, they are able to live for a long time without having any problems with their lungs.